Craze that's sweeping the nation. Ozempic and its competitors, known as the GLP-1s, have exploded in popularity in recent years. You know this, changing the lives of people struggling with obesity, diabetes, and other weight-related illnesses. But for some, these drugs, they're often thought of as another Hollywood fad, reserved for coastal elites looking for a quick way to shed some pounds before jetting off to the beach. Well, one reporter set out to prove that theory wrong, scouring Middle America for Ozempic Town, USA. And she found it in Bowling Green, Kentucky. Bloomberg health reporter Madison Muller joins us now here. Madison, thank you so much for joining. This is really surprising here. What makes Bowling Green America's Ozempic capital, as you call it? What did you find when you visited the city for the first time?
Right. So when we went there, we started looking at the data. So we looked all across the U.S. trying to find places that had high concentrations of people with prescriptions for weight loss drugs. And like you said, we found Bowling Green and the surrounding area has like 4% of the people in that area have a prescription for one of these drugs. And so when we went there, it was immediately clear that there was a transformation underway. As you're driving into Bowling Green from Nashville, there are signs on the side of the main road, for these weight loss shots. When you go into a store and you talk to someone, like we went into a hair salon and the ladies there were talking about the drugs. You go into the local GNC vitamin store at the mall and there's, advertisements for GLP-1 supplements that can help with the side effects like nausea and vomiting. When you talk to the doctors there, they're also saying that so many patients are coming in and asking them about these drugs. And then you have medical spas cropping up to offer copycat versions for cheaper than the brand name drugs. So it's really everywhere that you look in Bowling Green.
That is absolutely fascinating. And with such a high concentration of Ozempic users, this must have had a major impact on the community and local businesses, because I know that you were telling us that you found that some grocery stores and restaurants were just empty.
Well, so that's what we thought. We thought that we would go there and that these restaurants would be empty, because that's what you hear a lot of times. We've, spoken to the CEO of Novo Nordisk, who says that food company CEOs are calling him and they're worried about the effects of these drugs. So we assumed we would go to Bowling Green and all of the restaurants would be empty, but it was actually the opposite. The restaurants were bustling, but what you see happening is the economic effects are coming through in other ways. So there are these medical spas and new businesses that are popping up to fill in demand, because like I'm sure these drugs are really in short supply. So a lot of people can't find them, or they're very expensive and they can't access them. Their insurance doesn't cover them. So there are these medical spas, weight loss clinics that are sort of popping up to help meet the demand. It's sort of obvious in other ways how these economic effects are playing out.
And Madison, is this transformation happening in towns all over the country? I can imagine this has such an impact on American life.
Definitely. That was sort of the premise of this story is, yes, we're seeing this happen in Bowling Green because there's such a high concentration of weight loss drug users there. But as more and more people across the U.S. go on these drugs, this is sort of a preview of what could be to come in many other cities. We're hearing, obviously, here in New York about drug shortages. And the more that you walk around, you're seeing signs for these copycat versions of the drugs that are being offered at medical spas. So it's really, we could all be in Bowling Green or in Ozempic Town at one point. And this is sort of just a preview of what's to come, most likely.
Absolutely fascinating. Madison Muller, thank you so much for your reporting on this. We do appreciate it. And we want to stay on this. Let's bring in Dr. Nate Wood, Director of Culinary Medicine over at Yale. Dr. Wood, thank you so much for being here to help us sort this all out. These drugs have taken the country by storm. I don't need to tell you that. But what do we know about them?
Yeah, morning, Gio. Thanks for having me. These drugs are really, really effective, and that's why so many people are on them. This is the first time really ever that we've had these anti-obesity drugs that are so effective and so well tolerated. And like in Bowling Green and many other places in the country, people just can't get enough of them.
And we are seeing a boom in knockoff drugs, and that's what starts to get dangerous when we start thinking about that. These places are called med spas. What are they offering? There's obvious risks here.
Yeah, it's a great question. So we think of them as copycats. First and foremost, you can go to your physician and you can get the name brand drug that's FDA approved from a licensed pharmacy. That, of course, is always best. But in times like this, when we have shortages of those drugs and there's such high demand, we are allowing compounding pharmacies to produce copycats, essentially, of those drugs. And there's a wide variety of quality of those compounding pharmacies. And like you mentioned, they are generally cheaper. And then sometimes you can try to get one of these drugs and even may think it's a copycat, but it might be not that drug at all, which can be quite dangerous as well. So as an obesity medicine certified physician, I always recommend patients to go talk to their physician first and be really careful online.
Always talk to your physician. With so many people taking these drugs for weight loss, what are the side effects that we should look out for? Because I know so many people, we all seem to know someone who has started one of these drugs and they talk about these side effects. What are they and how can you mitigate them?
Yeah, the most common side effects are gastrointestinal. So nausea, vomiting, upset stomach, diarrhea, and constipation, right? And so you hear some kind of opposite symptoms there. Some people experience one, some people experience the other, and some people don't experience any at all. So what's key is starting at a very low dose and up titrating that dose slowly with your physician. And then you can change how you kind of live your life in order to minimize these side effects. So eating smaller meals, avoiding foods that can give you acid reflux, and really focusing on maintaining lots of fruits and vegetables intake and lean proteins can be really effective. So most people are able to tolerate these meds, but for some folks, it's just too much.
All right, Dr. Nate Wood, thank you so much for giving us your expertise here. We so appreciate it. Thanks for joining us.